USMLE Step 2 CK Oncology Part 8. This will be prostate cancer. In every cancer I will talk with the subject. For example, the cancer in the lung, I will talk with the book of the pulmonology. So, and like say all kind of cancer, I will talk with the related subject. And I have a 15 book about the USMLE Step 2 CK. So I am reading all of this book, and I am planning to produce a very detailed lecture so everyone can understand better the book. And then if they just read my book and know all of this, hope they will be do very well in the USMLE Step 2 CK exam. So now let's talk about the prostate cancer. Usually happen after the age of 60. Black people is more risk to have prostate cancer than the white. Most prostate cancer discovered on post-mortem examination. So this cancer is actually clinically silent. Most cases, not always. Testosterone caused tumor. This means testosterone can increase risk to have prostate cancer. Estrogen prevent to develop the prostate cancer. Prostate cancer is adenocarcinoma. Adenocarcinoma arises from the glandular epithelium in the peripheral area of the prostate. Benign prostate hypertrophy starts at the center of the prostate. So urine flow will be decreased or stuck by BPS, benign prostate hypertrophy. Possibility is higher than the prostate cancer. But the symptom will be prostate cancer will be like the benign prostate hypertrophy. Let's talk about the metastasis to the bone. When prostate cancer metastasis to the bone, it can lead to bone pain. Like suspicious for cancer when these are present. Low back pain, which is constant, dull, aching, and the pain is not radiating anywhere. Movement does not make any difference of the pain, as is the lying down. Presence of neurological change. Physical exam. No pain in the vertebra and paraspinal muscle upon palpation. Intact muscle strength of the lower extremity. Straight leg raise test is positive. Diagnosis. Serum calcium level increase after metastasis to the bone. Patient may complain of the urinary frequency due to the obstruction of the urinary tract. Metastasis to the ureter lead to the ureteral obstruction, and it can cause the oliguria. Physical exam of the prostate cancer. Digital rectal examination should be done if suspect for the prostate cancer. Digital rectal exam may find rock hard discrete nodule, induration, and asymmetry. And when prostate cancer can be metastasized to the bone, lung, liver through the lymphatic system, such as the iliac paraortic node, and through the circulation. Diagnosis. After find the nodules, induration, asymmetry, after do the digital rectal examination, and like say you find the hard nodules, and after that do the PSA, and if PSA is high, and then do the transrectal ultrasound to guide the needle biopsy of the prostate. If PSA is like say if PSA is high, next step is to do the transrectal needle biopsy guided by the sonogram to confirm the diagnosis. If the biopsy report show that patient has adenocarcinoma, so we make sure the patient has prostate cancer. So every patient after measure the PSA, and if it come they greater than 4 nanogram milliliter, screening for the prostate cancer and benign prostate hypertrophy after the age of 50. PSA is prostate specific antigen. So all people after the age of 50 and do the PSA. Increase alkaline phosphatase if patient has bone metastasis. So after find the patient has biopsy show the adenocarcinoma, and then do the CT scan to assess the extent of the cancer. And if you suspect patient has metastatic cancer, then do the chest X-ray for lung metastasis, liver function, do the liver enzyme test for liver metastasis, and do the bone scan for bone metastasis treatment. So after confirm the prostate cancer from the biopsy report, do the CT scan to assess the extent of the prostate cancer. Non-metastasis is still in the prostate, do the radical prostatectomy. External beam, after that give the external beam radiotherapy or interstitial irradiation with implant. Evaluate the post-surgical specimen to find does the cancer extend beyond the capsule or not. If the cancer expands beyond the capsule, cancer may metastasize to the nearby area. After the surgery, follow the patient by measuring the serum PSA. So if it be local spread, external beam radiotherapy and hormonal therapy. Prostate is androgen sensitive, so do the orchiotomy. So you take first prostate gland, and after that you take the testis out. This radiation therapy is considered as a salvage therapy, which means when standard treatment fails, patient need radiation therapy. Take the prostate out, and you see that the PSA is increasing, then you are thinking is spread out locally, then you give the radiation therapy and also take the testes out, because testosterone can cause the risk to increase of the prostate cancer. After the radical prostatectomy, patient PSA was undetectable. For example, after some time of the surgery, serum PSA increase. What does it mean? Cancer is spread out nearby organ. Surgery is not enough for this patient. In this case, surgery is the standard therapy. Standard therapy failed, and so needs salvage therapy. Patient needs radiation therapy, which is called salvage therapy. Radiation will kill the residual tumor cell. For a long-time management, sulfate therapy need to control for localized recurrent disease. So this patient has localized spread of the prostate cancer. Prostate cancer go outside of the prostate gland capsule, you can say. Metastatic disease is metastasized, then give the hormonal therapy. Hormonal therapy include bilateral orchiotomy and combination of luteinizing hormone releasing hormone agonists such as flutamide and cyproterone product. Flutamide and cyproterone are anti-androgen. The goal of hormonal therapy is to decrease testosterone. So take the testes out and give the combination therapy of luteinizing hormone releasing hormone agonists such as flutamide, cyproterone. Both are anti-androgen. And follow the patient by measuring the prostatic acid phosphatase and PSA. Every male patient is checked for prostate cancer on regular visit to the physician office, but stop it if the patient is more than 75 years old. After 75 years, treatment for the prostate cancer does not respond. So what you gonna do if patient has metastatic prostate cancer? Like say metastase to the epidural space or the bone or both. Prostate cancer could metastase to the spine of the back, and patient could develop the neurological problem which could cause the imbalance of the patient. Physical exam would find bricks, deep tendon reflex, and weak tone at the rectal sphincter. Prostate cancer metastases to the epidural space of the spinal cord lead to cause the compression of the spinal cord. After that, patient develop back pain, weak tone at the rectal sphincter, paralysis of the lower extremity. This patient has the point tenderness at the L5 and LS1 at the back of the spinal cord. And diagnosis: radionuclide bone scan could show the uptake at the area of the bone which is painful upon palpation, such as at the lumbar region. So bone affected, it affects the spinal cord. So patient could have problem in the rectal sphincter and paralysis of the lower extremity. So this patient need radionuclide bone scan could show the uptake at the area of the bone which is painful upon palpation, such as at the lumbar region. Do the MRI and look for the mass at the spine. Treatment for the metastatic prostate cancer. This patient need orchiotomy, which may cause the relief of the pain at the bone. After the orchiotomy, if patient is still complain of the bone pain, give the radiation therapy, which is the focal external beam therapy. So metastase to the bone, give the radiation therapy at the bone. Leuprolide is the gonadotropin releasing hormone antagonist used for the metastatic prostate cancer. So rule out the strain on the back muscle which have generalized pain at the back, not point tenderness. Infectious disease can cause the same problem like the prostate cancer at the bone. Infectious disease can cause the abscess at this epidural space, and patient also has the fever. Both metastatic cancer and abscess can cause the compression at the thecal sac at the spinal cord, which cause the back pain and neurological problems such as bowel and urinary bladder dysfunction. So note, increased PSA both bound to the alpha-1 anti-chymotrypsin is prostate cancer. Otherwise, bound amount increase then free PSA. An increased PSA in free form is benign prostate hypertrophy. So alpha-1 anti-chymotrypsin with the PSA increase in prostate cancer. Note, cancer metastasizes to the bone, lung, breast, prostate, renal, and thyroid in the prostate cancer. So, what about the solid testicular mass? Now, cancer in the testis. Patient in the physical exam find the painless hard testicular mass. You do the diagnosis, ultrasound at the tested hard mass at the testicle. Treatment: radical orchiectomy by doing inguinal incision, which is called high inguinal orchiectomy. So take the testis out if you find the hard mass in the testis, including testis and the cord related to it. So take the cord and testis out. After that, do the tissue study under the microscope to determine the specific testicular cancer. So number 2, after identify the cancer may need further surgery, radiation, and chemotherapy. Prognosis is good by chemotherapy even the cancer is spread out. So hard mass, take the testis out, look for has any cancer or not. And don't do the fine needle biopsy, which may help the spread out of the cancer neighboring area. So this is the end of the oncology part 8, and other oncology I will talk with the related subject.